I guess it's 9:31, and we've got 58 people and more people coming in, but we'll get started here. And I'm sure people come in. I think we had 130 some people registered for it, so we're expecting more people coming in as it comes in. Welcome again. This is our third Reopening Genesee Zoom webinar that we've had, and if we happen to schedule these the day before we're expected to have the next phase open. There's no guarantees that phase 3 is going to open tomorrow because it's up to the governor and when he decides. But all signs, well, I'll leave that up to Paul to say. But it seems like the signs are looking that way, and some of the guidance has been out. But before we get started, though, I do want to thank that where this came out of, where this evolved out of, was we have a Reopen Genesee committee that or task force or whatever you like to call it, but a group of people that got together real early on with this and started looking at ways to help our businesses. Whether at first it started out with the loan programs and helping with the loan programs. Now it's kind of morphed into helping with the reopening guidelines. And I just wanted to recognize everybody's involved with that. The GCEDC, Steve Hyde, Chris Swazi, Jim Krenchik, Mark Massey has been involved with that. From the Downtown Bid, we've got Beth Kemp. From the Batavia Development Corporation, Andrew McGuire. Dr. Marty Moore has been, from the city of Batavia, has been involved. Jay Gazelle from the county has been involved. Matt Landers from the county has also been involved. Matt's going to be the new Jay Gazelle in a couple of months. And from Freed Maxick, we've gotten good consultation from Freed on a lot of the accounting procedures, and Jonathan Treader and Laura Landers have been very helpful with that. So those are the people we've been meeting every week on this and everything. We also have, this is not just Genesee or Genesee County Zoom now, because we have Genesee Orleans. Paul Pettit is the head of the Genesee Orleans Health Department. Kelly Kabbalah has helped she's from the Orleans County Career Center, and she's helped coordinate Orleans people. So welcome Orleans people on this Zoom webinar. I'm going to turn it over to Paul, and I think we're going to start as we usually do and go through some of the metrics that we've had and where we're at and where we're looking at being in the future. So Paul, it's over to you.
All right. Thanks, Tom. Good morning, everybody. It's nice to see you all again. This seems to be a reoccurring every 2 weeks now. So this is our third one, as Tom mentioned, that we've done. And again, I'm happy to hop on and do these with all you folks. I recognize a lot of names and faces in the screens as you guys hop on. So welcome. I know I haven't talked to some of you in a while, so it's good to see faces. And I'm glad to report, things are, going pretty well on the data side of things. I do want to thank you all, especially on the business side and in our community organization side, for again, going through this time period and doing a lot of the hard work to get where we're at. As we've talked about the last couple of weeks, we know this has not been easy. We know that it's put a lot of strain and stress on you all as business owners and organizational leaders. And this again is not something any of us wanted, nor wanted to face and deal with over the last 3 months or so. But again, I think that together as a community, as Genesee and Orleans County, specifically, our folks have done a great job. You all, again, as leaders in your organizations, have done a good job of maneuvering through these times. And now we're at a point where we are moving forward. Obviously, we're kind of nearing the end of phase 2, opening up and looking forward to phase 3. As Tom mentioned, presumably that should be tomorrow, with the big asterisks and the big unknown here that we cannot guarantee and we can't promise that that's going to happen tomorrow. But what we can do is, I think, again, look at our data, and I'm going to walk through that in a second here and just kind of give everybody a snapshot of where we're at again. But based on what we're seeing locally here in Genesee and Orleans County, but also regionally in the Finger Lakes region, which is the group that we're tethered to for the purposes of COVID-19 reopening, things are trending very positively. We've seen a great trend over the last 3 to 4 weeks anyways. All of our data points that we monitor and track on a daily basis are all trending positively for us. So from my perspective, I don't necessarily see any reason why Finger Lakes will not be moving into phase 3 tomorrow. Again, something that we should be very pleased with, and glad that we've met this goal here. And again, I know for a lot of folks, maybe not fast enough, but again, there's this balance between trying to make sure we're keeping our numbers and our folks safe, in balance with getting our businesses up and running. And although, as I mentioned, maybe too slow for some folks, we are moving in the right direction, and hopefully, again, phase 3 tomorrow, and phase 4 here within the next couple of weeks. So again, thank you for all your hard work and sacrifice, and hopefully we can get things going here. And as we've done the last 2 sessions here, I'm happy to try to answer any of your questions. As we report every day and on these Friday briefings, things are very fluid. Things are changing rapidly. We've seen this several times, even with phase 1 and phase 2, where the governor kind of does these 180s mid-phase. And a lot of that, as I reported, is a lot of advocacy going on behind the scenes. We do know that our control room group, our elected officials, Shelley Stein and Lynn Johnson in Orleans County, they're doing a great job advocating. I'm advocating through, the public health side of things, and pushing things up the chain, and again, trying to get some more common sense approaches to some of these different rules and regulations that have been put in place, especially knowing that our data is where it is at the moment and looking very good. So we've seen some of those mid-phase corrections, where we saw even in the last one where restaurants were allowed to have outdoor seating in open air spaces. That was not supposed to happen until phase 3. But again, I'd like to think there was some movement on our end, as I said last time, that I think there's things that should be done and should be allowed. And fortunately, I think in some of these areas, the governor is listening, to some of those things. We saw that with the faith-based organizations, where obviously they were allowed. Technically, they weren't supposed to be till phase 4, but they went to less than 10, and then now in the middle of the phase again, we're bumped up to 25%. So I think as we push more, as we advocate, for you all in our communities, and again, looking at the data and trying to make common sense decisions, hopefully we can keep pushing and trying to get even greater and faster relief in some of these areas, so that we can hopefully, move us forward as quick as we can, but again, as safe as we can. Also, just something to keep in mind, we're getting this question a lot, around the gathering size of 10. It is still 10. We've been trying to keep that pretty clear for folks. We've been hearing a lot of people say it's 25, it's 50. The governor's order and executive order on this stays in place till at least June 21st. At that time, it is expected that there will be some decision, hopefully that it will be upped at that point. But again, there's been no clear indication to us on what that's going to look like. We can kind of see maybe from some of our neighbors what potentially may happen. We did see that New Jersey obviously upped theirs this past week for indoor gathering size and outdoor gathering size. So, again, using that potentially as a base metric, we could see maybe where New York would go with that. But again, no guarantees. That there is always a possibility he's going to say we're going to keep it 10 for another 2 weeks or 4 weeks. So again, that is the current executive order that's in place for all of us across New York State for gathering sizes. So again, that's what we're continuing to push out. So I just wanted to make sure that everybody was at least aware of that and understood that that's currently where we're at and kind of the time frame on it. So anyways, I'm going to, kind of pop up some of the data here. I can share my screen and just kind of go through where we're at, just again to give everybody a baseline, and we can kind of walk through some of this, walk through the Forward New York website as we've been doing, and then I'm happy to obviously answer any questions that folks may have, or try to answer questions, and we can go from there. So let's see here. I'm going to share my screen. Let's see. So the first thing I'm bringing up, this is included in our daily press briefings and reports that we put up on a daily basis through the health department. This is for both Genesee and Orleans County. So hopefully a lot of you have seen this, but I'm just throwing it up there real quick. And as you can see where our numbers are, these are just quick shots of kind of the cumulative numbers for positives for Genesee. We're at 201. We've had 5,608 negative tests. We only have 5 folks in mandatory isolation at the moment, and 49 under mandatory quarantine. And with 5 deaths, and the number that keeps climbing, which is a good thing, is 140 recovered. So those are folks that were in isolation, and now they're over into the recovered category. So dropping down to Orleans, 246, 3,163 negative, 9 in isolation, 35 under mandatory quarantine. 48 deaths. And as we've obviously talked about a lot over the last several months here, we've only had one community death in Orleans County related to COVID, and 47 of those are unfortunately from nursing home cases. And what's that?
I don't think we're getting this screen share.
Oh, it's not sharing?
No.
Let's see.
Yeah, I think you got
Did
it.
it pop up now?
Yes, it is. Mhm.
All right. Operator error. My bad. So there it is. So yeah. So and again, 94 recoveries in Orleans County. Then we do a age breakdown there, and again, this is just more a little dive into demographics, showing that obviously, as you can see, all age groups are being impacted by COVID. And then dropping down, we have our non-county public regulated facilities and cases within them. And if you see facilities or you know of facilities that are not listed here on this chart, that just purely means they have not had positive cases within those facilities. If and when they do, again, knock on wood, they don't, because again, we don't want to see COVID cases specifically in our senior type living centers, because as we know, it hits them particularly hard. But they would be added into this list at that point. So again, you can see the majority. Buffalo Federal Detention Center, as we all know, that was quite a while ago. We have not had any positive cases in well over a month in there. And then obviously the nursing homes in Orleans County continue to be a significant issue, with cases and unfortunately deaths. All right, so that's a quick snapshot on the data from that perspective. So I'm going to jump over and I'm just going to bring up our, let's see what I got here in a second. This is our online mapping tool. Hopefully you've all had the opportunity to see this too. This, again, I want to give credit out to Genesee County Planning and Erin Pence specifically. We worked with her quite a bit about 2 months ago to put this up, and this does track Genesee, Orleans, and Wyoming County. They've been added into this, but this is an online data tracker that's very locally customized. It shows obviously confirmed cases, active cases. It has a mapping component to it, and then obviously breaks out a lot of different data points, and you can go through this and look at it based on county. So if you just want to see Genesee County, you're able to click on that in the upper right and then just break down and see the data points for Genesee, or again, Orleans, you could do the same thing. So again, hopefully this is helpful for folks if they need to see data in a different format per se than just the numbers. But again, this is all localized. We know that there's national and regional, or state and regional data available, but we want to make sure our folks had opportunity to see local data. All right, so let's get into our metrics for phase 3. So again, we've been tracking these things and monitoring for quite a bit of time now, for the last month or so. And I'm going to bring up, see if I can find it here. Here we go. Sorry, I'm jumping through these screens, but I want to make sure you guys can see what I'm looking at here. Okay, so as we've gone over in the last session here, we looked at the different data points we look at from the regional control room, and this is all of the 9 Finger Lakes counties combined. So I'm just kind of going to scroll down here, but as you can see, as I mentioned earlier, we are trending in the right direction. So going back to June 2nd on this chart here, you can see new hospitalizations per 100,000. A couple of weeks ago, only a week ago, we were at just under 1 there. And now we're down to 0.71, again, per 100,000 new hospitalizations related to COVID. So again, that trending line is going the right direction. When we look at overall hospitalizations for COVID, again, you can see the trend lines here, 209 down to 184. And then and that's in the regular hospital beds. And then if you take into account ICU beds, incident care here, 34 down to 23. Again, all trending the right direction. Bed capacity is getting freed up. Here, if you look at the capacity side, things overall bed-wise are holding very flat, right where we want to see them. Again, the metric is we have to have at least 30% availability for both the ICU beds and the total beds. So again, 37 and 52, looking very good there. And then we get into some of our testing numbers. So new positives. So again, this is on a 7-day rolling average, what we're showing here. This is for the whole region. You can see 48 is where we're at a week ago. We're down to 35 on average here. So again, new positives are down in the region. Tests, again, new positive test percentages are down. So again, a week ago, 1.5% of all tests were positive. Now we're down, we've cut that in half basically. Only 0.75% of the new tests are positive. And I think a lot of that's attributed to the testing increase. You can see, the volume of testing in the region is significantly increasing. And a lot of that is being driven by the nursing home mandates on 2 times per week for testing of nursing home employees. And if you have not heard yet, that was changed yesterday by executive order. Again, there's been a lot of pushback on that requirement to test twice a week in these type of facilities. So that has been changed and is now only required once per week. So again, a lot of those testing numbers you can see as they've climbed, that will probably drop back down again with that change. So overall, that's kind of the snapshot of the region as far as our data that we've been following from our phase from 1 to 2 to 3. So again, hopefully you can see there that things are trending positively. As I mentioned, again, I don't see from my perspective on the public health side how there's anything in this data that shows anything but we're ready to move to phase 3 tomorrow. All right, let's see here. So stop sharing that. Let's see. So again, moving in the right direction. And there is another screen here that I'll share that is available for folks. And this is, I'm going to go through some Forward New York screens here. So just bear with me. So on the Forward New York, there is a data section. So folks are able to go again, if you, I just shared what I had. That's more of an internal document, but this captures very similar data. This is available to everybody in the community that wants to go on and take a look. But it is our regional dashboard, and looks like it's reloading here. Hold on one second. And you can check it by obviously the different regions in the state. But again, we monitor the Finger Lakes for our purposes. So let me hop on there again. So again, you can go through similar to the very same metrics that I just went through and monitor them on your own. So feel free to do that at any time. And again, shows you kind of our trend lines that I just went over. And this is the most current on the number of testing positives, the rolling test, number of bed capacity, those type of things. You can click on them, go through the data as you would like. But that is available for folks, so feel free to utilize that as you would like. All right, so I'm just going to pop through some of our other local information, as far as where we want folks to go. So Forward New York, as we've said many times, is the one-stop shop for all things COVID-19 related to New York State. So again, we want to encourage folks to go there. We get many calls every day with individualized questions, and a lot of the answers, and if they are available, we do send folks to Forward New York. So make sure you go there. There's a lot of information on obviously the data, testing locations. That's been a big question of where can folks go get tested, within Genesee and Orleans County. And as we've been talking about quite a bit over the last 3 months, it's still not the place where we would like to see it. We still do not have an overall community testing location that we would like to have for our residents to utilize. We do have availability through UMMC, urgent care, private providers, but there still is not a location where folks can just go and get swabbed and that's all they go for. You have to go to Rochester, Buffalo, other locations regionally to get that done. And we are, as I've said the last couple times, pushing hard on this. I think we're getting close. We've been having some conversations in the background. So hopefully soon we'll have some good announcements on some availability on the testing front. But there is, a site on Forward New York where you can go, and it does bring up all those locations on availability for testing. And I know that's probably going to be something that you folks may want to tune into specifically. As we know, the nursing home mandate, obviously that's being done within the nursing homes and the adult care facilities. But obviously tanning or hair cutting salons, barbers, et cetera, had the mandate that they had to get swabbed every 2 weeks. That is still in place. So they are required to go, which is why, again, we want to get some local capacity for this. But just so everybody's aware, I can't really fully say this is going to happen, but what we've been hearing and the assumption may be that as we move into phase 3, again, hopefully tomorrow, there may be some additional requirements for swabbing of phase 3 businesses. There hasn't been any confirmation on that. But again, looking what the governor put in place for phase 2 with, again, the haircutting position where they have to get swabbed every 2 weeks. Phase 3, personal care specifically, where technically one would argue maybe there's more close contact, right, which is why they were put into phase three, higher risk. It would not be shocking to us if, again, there's some mandate similar to that where they would require potential swabbing every 2 weeks of folks in those type of businesses. Again, no formal word on that. I just wanted to throw that out there. So if you happen to be one of those businesses on the call today, that you may be thinking about planning for that. And again, we want to try to get local testing so you don't have to travel to go get this done. So we're working on that for our local folks. But again, just keep that in the back of your mind if you happen to be one of those personal care businesses opening tomorrow, that mandate may be put in place for you folks also. All right, so again, let me share screen here, see if I can get to the right page here for phase three. Oh, all right, so one thing I wanted to talk about was the Lookup tool. We've talked about this quite a bit on our last two calls. This is available again on Forward New York. So if you happen to wonder what category you may be in as a business, go to the website again. You can type in your specific information using, I think there's a spot for your different tax ID, et cetera, that will then allow you to see potentially what phase you may be in. I'm trusting that most of you by now know that either you're open in phase two, you're at phase three, or obviously whatever category phase four you may fall into. But again, this is something for niche organizations that may kind of be a hybrid of maybe some of these different phases. So feel free to use this Lookup tool. It's fairly intuitive. You just kind of put in your information and it moves you right through. So again, feel free to utilize that as a tool, as we maneuver through this. Let's see here. So the other thing I wanted to share real quick, just as a reminder, is the safety plan. We've talked about this quite a bit. As everybody should be aware at this point, every business, organization, faith-based, any group that has employees or volunteers, et cetera, and has folks coming in from the public needs to have a safety plan. That's been clear by the governor. There's nothing that says this plan needs to be reviewed or approved, but you have to have at least gone through the process and filled one out. So again, this is available as a template on Forward New York. We've been talking about that. I know Tom's put that up on their website and pushed that out as a template. So feel free to use this, customize it as you need. Again, every place is different. So we're happy to continue to push this. We do have information on our website with some guidance documents, but again, this is fairly good and detailed. It covers all the different areas that we want folks to be thinking about. And again, not all of it may be something that each business needs to worry about. Again, this is kind of a very generic one that just covers a lot of different things. So go through it, utilize what you need to, but ultimately the goals here are making sure you're protecting your employees and protecting those that utilize your businesses. So again, the goal here is around social distancing, reducing capacity, masking, cleaning requirements. There's a lot of stuff in here, a lot of guidance documents that you can click on, links, et cetera, that will take you to information to help you through that process. So again, something that is available, and we want to encourage folks to, utilize that as, as a resource for them. And one of the last things here I'm going to bring up is phase three. So again, on Forward New York, so go there and check it out. But phase three information is up here. And again, I'd like to think this is a little bit from our advocacy and pushing. As folks know, we did have Tom and Kelly push this out earlier this week. The guidance documents for phase three actually came out earlier than phase three was announced. How about that? It's one of those things that, as we know, phase two, when it did get announced, the guidance was not there. It took a day or two. It kind of slowly trickled in. And I think through a lot of unrest and angst and frustration, the governor apparently moved a little quicker this time and put out the guidance document for our phase three businesses that'll be opening ahead of time. So that was a welcome thing. So again, food services and personal care are the two primary categories for phase three. So again, the guidance is there. So if you happen to be one of those businesses, we strongly encourage that if you have not looked at it, that you take the time to look at it. It does have all the requirements that are in there for the business, as far as capacity, the requirements around social distancing, masking requirements, et cetera. So make sure to use that and as the guide along with developing your safety plan. So again, that's there for you. The read and affirm tool is there. So again, they're encouraging businesses to go through and attest that you understand the rules, regulations, et cetera. And then obviously the business plan template is available, as we just kind of went over. So again, phase 3, food service, personal care, those are up there. They are available. We strongly encourage you to go on and utilize them. And obviously, if you have questions, there is a spot there where you can submit questions and try to get clarifications on things. So again, that is another good thing here that's been put up and available. And phase 4 obviously is not open yet, but when we get down the road another week or two, hopefully the phase 4 categories will also be pre-populated well in advance, hopefully, of when phase 4 is going to happen. We'll see. Again, we lobby and push hard for this so that obviously those folks will be able to, get ready ahead of time and not try to be reactionary. It's very tough to plan and to get things ready when you don't know what the guidance is, because it may change from what you were hoping it was going to be. All right. So I guess as we, I see Jay hopped on too. So as we kind of wrap up some of these things here, and I don't know how you want to move over to questions, Tom, at some point here, but I just want to remind everybody again, things are very fluid. They're changing day by day, minute by minute. We do have a press conference coming up in about an hour and a half or so we may learn new stuff today, which is why, it's very important that we need folks to continue to follow Forward New York as best they can. We are pushing information as quickly as we can, but again, I'm not going to tell you we're getting it much quicker than you guys are. The reality is sometimes you guys know before we do. So it's challenging to, I think, really break down and really ascertain what's factual, what's not, which is why we're happy to do these calls and happy to push information locally to try to keep you all as informed as best we can. So that's kind of what I have just on the updates there, Tom. So I don't know if you want to. Yeah, go ahead.
Yeah, I see Jay's on there, and before we get to the questions, maybe we can see if Jay has something to say. Jay always has something to say. I wanted
No, not me.
that I have my hat here right in my office.
There you go. Genesee is great already. Remember that. Particularly you, Joe Forsyth. I see you checking in on me. As Paul indicated, this is something that is very, very fluid. Also with regard to what it is that we don't know. Again, we use the control room that Shelley and I and a number of other the county executives and local executives, chief electeds, are on a daily basis with Vinny Esposito and Bob Duffy to push the inquiries and questions that people have, clarifications. Even on the outdoor games, the low impact, low echelon games, when they came out with outdoor activities, they had things like shuffleboard and batting cages. I wanted to know what shuffleboarding meant, really the kind of my grandparents played, or what I would do when I go to a bar with a puck. That to me is shuffleboard, but apparently they don't, that's one thing they don't, so to speak, dive into in terms of depth. But like Paul said, this is something that is very, very changeable every day based on what the press conference does. And that's why we always continue to tell people, go to New York Forward, check on the listings, look at in each of the phases, what more detail comes out on a regular basis. These guidances, which all seem to be magically about 13 pages per industry type or group, are pretty good primers, but also you got to do the safety plan. You have to have the safety plan on your premises. You got to attest that you are ready just in case somebody comes and visits you and is not a customer and is not an employee or a family member. So that's the thing we continue to suggest and make sure people understand that, because at the control room level, there is nobody in control. It is strictly the second floor in Albany, and that small cadre of people that the governor has surrounding him, who are, shall we say, calling the shots and then letting us know, sometimes in advance. But like Paul said, even on midnight of, to tomorrow morning, ostensibly there could be new things coming out that didn't even get released during the press conference. But that's the nature of how we're doing things. One of the other things I noticed that we saw, there was a question. We haven't heard anything, Paul, to the best of my knowledge, about there being a phase 5, like for the cruise lines on Lake Ontario or things of that nature. We think that pretty much this is going to get us through most of the industrial and business sectors. And then at that point, it will be what more needs to be going on as long as C-19 is continuing to be a healthcare issue for us in New York State. Remember, we're 1/3 of the entire mortality in the country at this point still. But again, we're also seeing, based on the metrics and the dashboards, that we're in pretty good shape, particularly in the Finger Lakes region. And we are part of a region. We are not a sole individual county. We in Orleans, even though we share a public health director and other staffing opportunities, we don't get to go on our own, no matter how good our metrics are and how our healthcare systems, are working in unison, which is exactly what's been going on. So again, we are adhering to the guys that hopefully every 2 weeks, there will be a new phase coming and ready to go. The one thing we did hear yesterday in the control room, that phase 4, based on how large the phase 3 grouping is going to be, there might be a delay there. But again, it's all based on the science and the metrics, and not because which way is the wind blowing.
Jay, something you touched on there briefly too is the reading and affirming the guidelines. I think that's kind of got overlooked a little bit and everything. Yeah. When you go to the website, yep, there, pretty much everybody that opens is supposed to do that, right?
Yes, and we get a report every day from the Finger Lakes Regional Control Room that indicates how many more industries by county or businesses by county have actually gone in and done their affirmation and attested to the fact that they have a plan. So it's being tracked and monitored, and it is something that, while it is not on the dashboard per se, it is something obviously that they are paying attention to, as to, shall we say, the secondary thought process in terms of which regions can continue to go forward as far as from phase to phase to phase.
So no matter what phase you opened in, you should have gone to the website there.
Yes.
There's a little button there under your particular category. I'm looking construction right now, and it's read and affirm detailed guidelines. You read and affirm that, and you press a button there, and I assume it goes to Albany that you've done that.
Exactly. Like I said, when Vinny and Bob Duffy were actually sending us these daily updates on the number of businesses by counties that have gone through and done the affirmation, it struck me that they're very serious about this, and they are making a list and they're checking it twice.
Okay, good. Thanks. I do have a couple questions that came in previous to this. And anybody who wants to add a question can put it up in the chat there, and we'll get to them. I know Jay already touched on one of them we got from about phase 5, but here's a couple. I got one of our hoteliers would like to know when they are able to reopen their breakfast area as well as their pool hot tub, if that is known at this time.
I think that's one directly for the master of health over there.
So, as far as the breakfast areas, I would say that starting phase 3, it's food service. So I don't think there's any issue with that opening. Again, you're going to have to take into account the same type of criteria that is in place with those guidelines I mentioned. So I would refer you to there as far as, what needs to be in place as far as reducing capacity in those areas, making sure you have the minimum of 6 foot, from those areas. Again, masking for any of the workers that are, stocking and putting food out, et cetera, and interacting potentially with the hotel guests. So, again, as long as they're meeting the requirements that are set forth in the food service guidelines, I think you'd be all set to move forward in phase 3. As for the pools, this has been a bit of a moving target at best. There's been a lot of discussion around this. We have talked to the control room about pools and got information out that, back from them that technically they were not really closed in a lot of different settings, potentially depending on where they were. So again, what we're telling folks locally with pools at the hotels and those type of situations, again, you have to have your plan together, similar to what the beaches. You have to have reduced capacity. You have to maintain masking groups less than 10. Obviously, when you think of a pool, some of these are not very big. So again, it's going to really, really limit the amount of folks who could utilize these pools. And, obviously, you can't be from mixed groups, so to speak, and maintain your social distancing. So you're talking about family units only. So again, it's going to be a little more challenging when it comes to the pool side to meet the requirements that they have in place. Again, looking at the beaches as potentially a blueprint for that. So again, what we're telling folks is, get your plan together, figure out how you're going to be able to do that in line with the social distancing requirements, and then we can go forward from there.
Okay. I'm going to back up to the reaffirmation. We've got a couple questions on that. Actually, Paul, probably be helpful if you could share like one of the pages and show that. But the one question I got, should businesses reaffirm guidelines even if they aren't permitted to open yet? I think I even can answer that one. I think the guidelines aren't out there, so you can't
Right.
reaffirm. So it comes with your phase. We're only at
Right.
phase 1, phase 2, phase 3, but each of your individual phases, depending on what your business was, there it is. Okay, so there's for food services. Paul's showing it.
So yeah, for example, as Tom's talking here, I'm just going to click through it. So and this is all the different sections have this kind of summary guidelines, read and affirm, and the template. Right. So you would click on that, and
if you haven't opened yet and you don't have your guidelines, you can't reaffirm. So you don't have to your time to reaffirm.
But I think in general, also in the control room has told us this a couple times also, those businesses who are already in and in one of the earlier phases, if they have not gone and done that, they should go circle back and take care of that. Yeah, it's ministerial, but again, it's basically the guidance, not only literally and figuratively, but it's the nature of how the state is, shall we say, doing their overall monitoring and probably in an after action analysis, determining how well they did it, so to speak. So again, the idea is that, if we're already in one of the phases and the business is already there, even some of the essential businesses, is to go back in and just go through the affirmation and the attestation that you got your plans in place. They're sitting at your business or your businesses, if you're, if you have multiple locations, and that you are up and doing what you're supposed to do.
You just answered our next question on the chat. There was, if we've been open all along, do we have to go back and do this? Pretty much.
Yes, the control room people in the Finger Lakes control room are telling us, yes, that should be taken care of. You should do that.
Okay.
So again, I just scrolled through it a little bit, and that's there. So you go through the whole thing, and again, the attestation mirrors the safety plan, especially the core areas of that. So again, you go through there, and when you get to the end, you can obviously click and affirm at the bottom. And that's how that, as Jay mentioned, we get those daily reports of all the businesses and organizations that have attested. So that's really the process for that. So again, everybody should be going on and doing that.
Okay, would HVAC be considered construction?
I think that's one for ESD, literally. My sense is when you go to the New York Forward, based on the NAICS codes, that tells you, basically which phase you're in and how they've categorized you based on the state nomenclature and using, a tried and true method that's been out there for almost as long as I've been alive, and that's a long, long time, which is those NAICS codes.
So as we talked about a little bit earlier, I just put it back up again. This is the reopening lookup tool. So as Jay mentioned, you go here, essentially, you type in your information, you use your code, and it's going to give you a determination, on whether you're open, you're not open, what phase you may potentially fall into. So again, this is where folks should go if they're uncertain whether they are in one of the bigger buckets. We'd encourage folks to go here and try to get that answer.
Okay. Next question I've got, maybe you have to use your crystal ball here a little bit, but do you foresee guidelines for churches changing with each phase implementation?
Well, the only thing that they've done so far, and correct me if I'm wrong, Paul, is increase the number of people who can participate in an internal religious activity. But again, following all the other guidances and protocols. So, it's again, this is what Paul uses the term a moving target. It's something that they obviously are, shall we say, wrestling with, just like they were for weeks on the whole idea of a campground, or things of that nature. What was or wasn't not connected to what's the state got closed or not closed, things of that nature. Paul, you got any more insight?
No, I think you're spot on with that. It is a moving target for us. Again, there's a lot of I think advocacy and pushing up the chain for these different type of activities and groups to get moving a little quicker than potentially being allowed. And we've seen that again, as I mentioned earlier, in the faith-based type organizations where they were closed, not potentially targeted till tier 4. They went to 10 or less, and then a week later they went to 25% capacity. So our the biggest thing we keep pushing to folks is be ready. Have your plans ready. Have your communication with your staff, your board, whatever it may be. so that when the green light comes, again, it could be at an 11:30 press conference, it could be, who knows, that folks are ready to then move forward. So again, with churches, faith-based groups, we are at a 25% level at the moment. That could be bumped up at any point to maybe 50%. So again, we'd encourage you to do your plans, put them together, have them ready to go. Make sure you're adhering to all the social distancing recommendations, and hopefully we'll get some relief and some increased capacity and allowance here in a short time.
Okay. And what about weddings and indoor wedding venues? Would that be considered entertainment or recreation? I'm not really sure. But and if so, will buffets be allowed?
Yeah, so again, that's a bit of a moving target too. The weddings is challenging, and that really goes back to the guidance on the amount of restriction of gathering sizes. So what we've been seeing is, some of these different groups, again, going back to faith-based, now with graduations being allowed at up to 150. Essentially what we're seeing happen here is cherry picking of different events and or settings being allowed to gather in excess of 100 or in excess of 10. At the moment, there hasn't been any indication on like social type gatherings like weddings, big parties, birthday, whatever it may be. Those still technically fall under the guidelines of the social distancing or the social gathering sizes. So until we see some relief, and I think some increase, as I mentioned, at the earliest, looks like June 21st. Those type of activities are still very limited. But again, I would assume some of those bigger things would fall under phase 4 potentially, where you have larger group gatherings and how those will play out in these big kind of wedding halls and venues over time here.
Yeah, the thing I think we've seen with regard to the guidances and some of the details that come out as each of the phases opens up, there doesn't seem to be what I would call the absolute master plan, that a lot of these things have actually been, really put to a great level of detail and documentation as far as the state itself is concerned. And then that's why I think you find, and some of these subsequent releases start to, shall we say, nuance what the phase and what's in the phase, and in some cases accelerating something that maybe most of us thought was going to be in phase 3, got thrown back into phase 2, things of that nature. Again, the key really always is go to that New York Forward site, and then from there you can also look at the New York State ESD site that has all their information on it, because they really are the arbiters of this whole thing. Even more so, I sense, than the State Department of Health as to which businesses are in which of the phases.
Okay. Another question we have here: are volunteers considered employees? And I'm assuming they're talking about that from a safety plan standpoint. So I would think yes, probably, right?
When it comes to the social distancing and the other things, yeah, it's people occupying space, so to speak, not so much whether they're employees or not. They're obviously, and when you read through these guidances and these details in terms of like the one for food service during COVID-19, that does get very much into what you are doing and your employees are doing, but then also everything else involving anybody who's on the premises, in the parking lots, things of that nature. So it really does get down to basically, how do you keep individuals within the protocols as far as safety and avoiding, having any kind of rebirth of the COVID-19. Mm-hmm. And thank you, Kelly, for putting the NAICS code upstairs.
Has any business in either the Glow region or Finger Lakes region had any enforcement actions taken against them? I'll let you guys handle that.
Paul, have you heard anything?
So we've, obviously had complaints and some concerns over time here with different organizations, and our approach has always been education. So we like to go out and, let folks know of the rules and regulations and requirements. So we have had a lot of those conversations. I know law enforcement in both counties have had a lot of those conversations. At the moment, I'm not aware of any formal enforcement that has been carried through. Typically through conversations, we've been able to, at least come to some level of understanding that, look, these are not necessarily our local requirements and regulations. These are governor's executive orders, but we are required to follow them. We've also, make sure we let folks know that if they're not following them, if they want to move ahead of what the governor's orders are and his phases, there is very well could be penalties. The governor, I think, has articulated that very clearly, that if people open early, if they're gathering in outside of some of his requirements, that there very well could be imposed penalties, et cetera. But I'm not aware of any type of fines or any issues beyond this educational component and cooperation, again, after conversations have been had. I think
Yeah, I know our local law enforcement uses the term communicate to educate. That's their approach, low key, not coming in, ready to lock and load on anything with regard to, a complaint that may come in. As you know, the complaints basically go through the state website and the complaint form that's there. And then there's, in most cases, get referred down to us anyway. We do have certain, I guess what I say, existing protocols as far as whether there's a health department permit or a license, whether there's, the one thing, the Liquor Control Authority is very much there and checking on things with regard to this, the outdoor dining and the liquor licenses and the extension of those to an outdoor location. That's a very big part of this current process and understanding. Also with regard to the whole idea of, something else that obviously is integral to a business, but it may slip through with regard to the consideration of the reopening. But that's why I know in downtown Batavia, through the bid and through the Business Development Committee and the city itself, they've been working on, how to make sure that the State Liquor Authority, as well as local authorities, are communicating and making sure that, there's nothing that would put somebody's business license in jeopardy.
Yeah. One thing to note there, Tom, too, we've tried to articulate this a little bit. And again, this is an unknown what could happen, but, as far as this is why we're recommending everybody check, insurance and liability wise, if you happen to open up outside of, potentially the phase that you're supposed to, and there's an issue, essentially you're operating in opposition of a governor's order, and there's some uncertainty whether insurances would cover if there was a fire or there was an accident or someone fell and there was a workman's comp claim. So again, we don't have the specific answers for those, but as businesses on this call, we want you to make sure you're protecting yourself. So if there is thoughts of moving ahead or moving outside the governor's orders, there could be some other implications that people really need to think through beyond just the immediate potential fines and those type of
things. And I think I can answer Brandon's question. And yes, in the newly expanded outdoor activities list for opening, shooting ranges are right there, right under batting cages and just in front of swimming classes.
Well, I've been there and I know that it's an indoor. He has an indoor firing range at the firing pin. Mm-hmm. So does that change things?
Well, it's under the general category of outdoor low risk recreational activities are permitted so long as social distancing and cleaning disinfecting measures are in place. So you're right, Tom. It starts with outdoors at this point.
Right, but I would think, I hate to do he could do the social distancing like anybody else, and I think it can be done in his indoor shooting range. So. Next question was New York Forward says fitness and recreational sports can open with restrictions. Does this include gyms?
Paul, I think that one's more what you've been experiencing.
Yeah, I mean, well, so, as far as again, what we're being told is gyms and those type of activities are still phase 4. So again, it's kind of this fine line, and we're trying to get clarification on a lot of these things. And again, there's so many nuanced, different operations and different activities that are occurring. So, at the moment, our understanding, what we've been told through the control room and ESD is that gyms specifically are still going to be phase 4 categories. So still another couple weeks.
Okay. What phase will the libraries open?
Well, I mean, again here, though, I think, overall, this has kind of been a moving target too, but I think some libraries have opened at very limited capacity, right, in lines with kind of retail. So again, they put their plans together and they are allowing, very minimal activity within those. I mean, they're not open to renting out their rooms and big gatherings in there. Obviously, they're maintaining their 10 or less. So as far as I know, the libraries have been opened at some level anyways. I don't know, you hear anything different on that, Jay?
No, I think that's exactly right, Paul. What they've been what they've been saying is because a number of these, and they sometimes are differentiating between the public library / something that might be a private nonprofit, things of that nature. It still gets back to we're sort of under the guise as the local governments were, that it's a 50-50 proposition as far as your workforce is concerned. Those who are in the building versus working remotely if they can, or just at home. and that so the return is you start moving back in gradually, but hopefully as of I think this Friday, even that provision would be pretty much taken away. But you again have to have all the same protocols in for social distancing, masking, face coverings, as well as the other CDC guidelines that have been part of everything that I know what we've been doing at the county as far as our safety plans, and having all those detailed by both building and for us by department, somewhat the same way that a library would function in terms of the children's room versus the adults versus the reference library, and those parts of the actual infrastructure.
Okay. I am not seeing any other questions here right now. If none jump up here right away, I think we're pretty good. I would like to actually mention that on our website, genesee-ny.com, we have a COVID-19 business resource page, and there's a lot of things on there. As a matter of fact, you can find your link to the Forward New York page. You can find information still on loans if you'd like. Still, there's the email that goes to the Finger Lakes ESD if you have a specific question.
Yep.
There's a lot of things like that are on there. So I don't know, Stephen, if you can you share that from where you are?
Yeah, give me 1 second.
Okay, all right. This might help since we don't have any questions right now. So I guess we're doing better. I think it does help the fact that the guidelines are out earlier this time. That I think people have some of their questions answered, or they know where to go to get them by now too. So that's been very helpful. So, but other than that, I think we've done well. So hopefully keep our fingers crossed that tomorrow goes well, or maybe even today he might announce it.
The one other constant we are told: do not get ahead of this guy as far as the second floor in Albany is concerned, because you know what hell has no fury like.
Yeah. There's the page. If you go right on the front page, hit a button, you'll end up on this page, and then you come down and there's all sorts of information. One of the things that's nice on there, you can scroll down a little, Stephen.
I'm just going to show them how it's on the front page quick.
Okay, all right.
Go right on genesee-ny.com. It's this front button here.
There you go.
All you got to do is hit that button, and everything that we got, and we keep updating that as we get things from Jay sends us stuff. Vinny Esposito sends a lot of stuff, so we try to keep everything in here. But scroll up a little bit, Stephen. The one thing I wanted to point out was the COVID-19 workplace posters. Everybody's going to have posters, and everybody's got to have signs, and everybody, no sense reinventing the wheel. We've got a group of them that we've gotten from the Business Council of New York. We didn't do them ourselves, but there's all sorts of things that you can put in there. Do not enter. I think that's a nice one if you click on that. Do not enter from the. But you can go print these out for free. So just go there, print them out, and use them in your business, and that'll save you some time and some money, and hopefully that'll help. So I just want to let you know about that. So that's always a good resource.
Yeah, and I was just going to say, we're going to add some of these links from today to this reopening part right here. That'll be done within an hour after this. So.
And we are recording it, and I think we got it right this time. So we'll have it up on our YouTube page. We kind of screwed it up when we switched hosts last week. So we should have it on our YouTube page later today. I know that Howard Owen has been streaming this live on the Batavian today. So.
And I think, Paul, isn't it fair to say also one of the things, and I know we're doing it in our buildings, but one of the things that come with the safety plans and other things is the signage that you put up on your buildings to give people fair warning, but also even for your workforce, for your employees, things that they need to be apprised of, and that you can keep sort of giving them those shall we say, subtle reminders. Because particularly in my world, a picture's worth 1,000 words. So just putting a picture up of me and Paul together will save like thousands and thousands and thousands of words being, thrown out into the stratosphere.
Yeah, so I mean, that's obviously part of the safety plan that everybody has to have. There's a whole section in there on signage and what needs to be up there and available. And obviously, as Jay was articulating a little bit around the screening for staff, volunteers, et cetera, that are in your businesses. when they come into work. So again, utilize signage, put it up. Obviously, some people are very pictorial, and obviously the signs that they just went through, Steve just showed, are fairly simple, right, to the point. I think they're fairly depict what we're trying to get the messaging around. So again, have them up throughout your business, on your doors and your break rooms, different areas. Again, so it's very visible for anybody that's working in your establishments or anybody that happens to utilize your facilities.
Hey, Paul, take a look at the last two questions. One from Steve DeLeo. Steve, is that an insurance question, so to speak, as far as the nature of a waiver? I haven't seen anything like that. And then with Brandon, I think one thing I think the county health department has been doing is, as you put your plan together, you can shoot them a copy of it just so they can look at it from the perspective of particularly our epidemiologist, David Bell, as far as maybe something that you missed. And it's strictly advisory. It's not an approval. We have no approval process or capability here at the county level. But Steve, I wasn't sure about what that question entails. Oh, okay. So Paul, it's back to the notion of someone who's asymptomatic and a checklist as far as what they should be looking for, in terms of the decision to have somebody stay at home and or present themselves for a test.
Yeah, I mean, I'm not sure of any waiver as in not doing it is what you're talking about. But essentially what we're asking folks, and if you look at the for the planning purposes, it's again about screening. The goal is to try to minimize. Again, you're not going to catch everything. It's not a perfect plan.
Yep.
We're asking folks to be honest and to share at least generically there if you're having any of these symptoms or you've been in contact with the case, et cetera. So ultimately this is something that employers are being asked to do to help try to, again, minimize exposure in the workplace. The temperature, the asking the questions. I know on the county level, we've been doing that now with all of our folks in the health department the last 3 months, but I know even general workforce is starting to do that now as they're coming back in. So
yeah, Steve, we have to start, and all the county employees, when they come into our buildings every day, have to self-attest whether or not they've already taken their temperature and whether or not they hit the 100.4. And if they have taken it and it's okay, we check off. If not, we have devices, thermometers there for the scan, the temporal scan. And then the rest of it is also the same CDC guidelines as to if you have any of these symptoms, you need to let us know, and we will then deal with you in terms of either as an employee, or we're starting the same thing, particularly like with our county DMV, what we're going to be saying to clients as they come into the building and then stand in what we think is going to be the lines, but with all those other protocols in place. Again, a warning, even with our signage, that if you have symptoms, you and we are not going to do this dance at this point in time.
Okay, also, we're getting a rash of questions here. So
yeah, I see they're rolling in fast.
yeah. And I did want to point out, as far as looking for guidance, I know Brandon talked about it. The health department would be people to go to, not the chamber. We don't really know anything over here. So we would just end up sending you to Paul, because we're really not the experts. We're just kind of trying to push out the information to everyone. So.
And we're happy to obviously chat with anybody that has questions or concerns. Again, we have limited staff available, but as Jay mentioned, if you guys have any specific questions, obviously there's some rolling right here at the end. Give our office a call or shoot me an email. We're happy to do these one-offs as best we can. And again, I see some stuff on the waiver. I guess maybe it's the terminology, is it a waiver or is it an attestation? I think a lot of people are attesting to things, not necessarily waiving, but bottom line, again, the goal is, if you have a masking requirement or you have these in place, folks, if they can't wear a mask, I think that's where you're getting into these attestations or waivers of why, maybe a medical issue or something like that. But ultimately, there are strategies around that, and including keeping obviously the 6-foot separation, those type of things, or again, trying to service and provide them whatever needs they have in a different format. So it's not a one size fits all. So there is some nuance to it. But again, I think a lot of folks are doing their best to try to meet the intent of the guidelines. So we appreciate it.
I had to do the same thing with what little hair I had left the other day. I had to sign in a form for my beautician to do that. And she's got all her protocols in place, entirely changed the inside of her shop and everything else. Mike Wall, with regard to the PPE, get a hold of Tim Yeager or Bill Shutt up at County EMS directly. They are the ones who are bringing these caches in. To some extent, that involve hand sanitizers, some of the face masks, and even some of the PPE. They have the I guess what I would call the direct line as to if there's more coming, and what the opportunities are for what limited supplies we have, try to distribute those, in the community in general, particularly as far as businesses as they approach each of these phases.
Okay. Well, we've kind of reached our hour maximum here, I think. So I appreciate Jay and Paul and for being with us. We'll try to keep these things going. I think just kind of looking ahead, I think you've already alluded to the fact that phase 4 might not be as formally at the 2-week period that the first 3 have been, just because of the number of businesses that are opening and or the types of business that be opening in phase 4. So, but we'll watch that, and I think we'll just try to schedule one 2 weeks from now and see where we're at that time, because I think these have been very helpful. And a couple things, if you didn't get your specific question answered, you can contact Paul at the health department. There also is that Finger Lakes COVID email. It's flnyf@esd.ny.gov. It's on our website on that COVID page. You can just click on it, and they are supposed to answer specific questions. So it may be more helpful at this time for everyone if you have a specific question for your business.
Remember also that we are part of a 10-group regions across the state. So a lot of these same questions are getting funneled up through the other control rooms. But in some cases, some of the other control rooms and the state have not been getting along very well, we keep hearing. So our Finger Lakes group has been doing a very good job, but also they've been very responsive to the questions we asked, pushing them up the food chain, so to speak, and then trying to make sure that they circle back if they haven't gotten an answer and they know those questions are still out there. And again, that's been a good thing in terms of both our participation, but also the people that we're dealing with. They and we are have been on a very good first name basis for a number of years. And I think that helps us with regard to who's in the Finger Lakes region and who's in the control room.
Great. All right. Well, thank you very much, everyone. Thank you, Jay and Paul. And stay safe, everyone. Let's keep moving.
Everybody be well and be safe.
Thank you. Yep.